Sunday morning talk focused on the political scene in Arkansas.
Welcome back to the program. Joining me now, State Senator Missy Irvin, Republican of Mountain View, Chair of the Public Health Committee.
Yeah.
Good to see you.
Great to see you too.
It's always good to catch up.
Yes,
happy to start the new year off with you and your colleagues up at the state capitol.
Yeah, we're happy to have you up there again.
All right, first week for Sarah Huckabee Sanders. It was historic and momentous, as we mentioned in the intro there. Give me your assessment of how she handled her first week in office.
I think she was strong and capable and courageous and just a very strong presence, and great to see a young lady and a young woman and a young mom take that podium and take this office and achieve what she has achieved this week. And it was so historical for, you know, all those little girls that are looking up at her, and it was just great to see a strong Republican woman take the office of the governorship.
Are we gonna live by executive order in this administration? We got Governor Asa Hutchinson, former Governor Asa Hutchinson used to make task forces for everything. I think she's gonna make an executive order for everything.
You know, she has been super clear about her partnership with the legislature, and I think these executive orders are just her being very clear in defining what her goals are and what her priorities are and the principles and by which she's going to operate and the different issues that she's very interested in attacking head on. And so I see that as a clear statement of how we are going to proceed under her leadership. And I have no doubt she'll be working, she already is, she's already been working with a lot of us in a partnership to achieve her goals.
All right, I do want to talk a lot of health with you, but I want one question on education first. For folks who don't know, you were the chair of the Education Committee last legislative session, so you know your education stuff.
Yes.
She's made it clear she wants to put an omnibus education bill together, which is going to have all of these changes she wants to make in the education reform front in one bill. Is that going to work? I mean, what's the reaction from legislators? Not necessarily your personal opinion, but what are you hearing from some of your colleagues about that?
Sure. Well, I just know from my personal experience, sometimes when your bill gets a little bit over even 5 pages, some of my colleagues look at me and go, what are you trying to do? But so I think it's going to be a good approach, though. I think it is time for a vast overhaul of education, and it's difficult to do it piecemealed, and that's just going to require, I think, a very comprehensive look at it. And I think that's just the way that we're going to have to proceed with it, to be quite frank with you. And I think her initiative is just so focused on reading and writing and making sure that we are improving those reading scores across the board. And that's been such a passion of mine and so many of us for many, many years. So I'm excited who she's brought on board. I think I've tracked his work down in Florida.
Jacob Oliva.
Yes, I've tracked his work down in Florida. I have a very good friend that is a reading coach there, and so I've tracked that progress. I think he's going to bring some strong curriculum-based policy work to really being aggressive in attacking those reading proficiency scores and raising them with intentionality behind the curriculum and what is being taught in the classrooms.
So just basically this is my interpretation of why it's going to be an omnibus bill like this, is there's going to be parts of it that some people are not going to like. And so you got to vote for the whole thing to get all the change, or you got to vote for against it sort of thing. So, I mean, do you think that's the political calculus here?
Perhaps, yes, but again, I think it does kind of, education is complicated. It's very, very complicated. And when you start to try to do any kind of a reform, you're going to sometimes you meet resistance just because folks are not understanding exactly what you're trying to do. But it's complicated in the way it's funded. It's complicated in the way that it is enacted between your local control and your state government. And so it really needs an entire reform, and I applaud her decision to go this way.
Okay.
I really think it's necessary and very, very important for you to get the levels of reforms that we need in education. Her approach is the right approach.
All right, let's switch to health, which is the main reason I got you here. So the unwinding of the Medicaid continuous enrollment, which happened during the pandemic, people were automatically enrolled in a Medicaid. That's coming to an end soon. That's got big policy ramifications. It's got big financial ramifications for folks that don't understand that concept of what's happening. Outline it for me, frame that up. So
we operate in Medicaid under the FMAP, which is the federal medical assistance program. And so that split between state share, state revenue, and federal revenue is about 70-30. So right now,
70 feds, 30
70
state.
feds, 30 state. Because of the public health emergency, that has risen to about 77.51%. And so with every 1% swing is about $65 million in state general revenue. So you can see that we're actually saving a lot of money because the federal government's picking up more of the tab. So that lessens the reliance on state revenue. But once the public health emergency is over, that swing goes back to that 70-30 split versus the 77 we're getting now. So that is lots of ramifications fiscally for how we unroll that and unwind that.
Well, basically what happens is people will come off the Medicaid rolls.
Correct,
They're not automatically enrolled anymore.
Correct, because during the public health emergency it was frozen, so you can't remove anybody from the Medicaid rolls, even if they're not eligible, which doesn't make any sense to me.
But we'll see people coming off the rolls in a pretty dramatic fashion.
But interestingly enough, of the about 1 million that are in Medicaid right now, nearly 477,000 of them are children. You have about 340,000 in our home, and you have almost 477,000 of children, and then about 317 are in your traditional Medicaid program.
Will we need any kind of temporary waiver, do you think, from the feds? Do you anticipate something
I really think that the federal government through CMS is going to try to figure out a structure to wean everybody down from that enhanced FMAP match. And that's the only way that I think everybody in the country is going to have to unwind from it fiscally. And I think the federal government is moving through that process. If they're not, definitely we would need to probably act that way.
Do you think that there's going to be, do you think the financial ramifications from what we'll lose from the feds, you still have people coming off, do you think it's going to stay in financial balance of some sort, or do you think the state's going to be on the hook for tens of millions of dollars, hundreds of millions of dollars, or maybe we come out better as a result of all of this change? I don't know the answer to that.
Well, so many people don't, but what I can say in healthcare policy, particularly with the Medicaid programs that we have, it is very, very important that you look at both the healthcare policy aspect, also the fiscal policy aspect, because of the dependency and the commingling of the federal government's money with the state's money. And so, that churn that is happening in our state economy equates to about $9 billion. And so this churn, and I think it was $3 billion in just the healthcare economy. It was about $3 billion over 5 years. So when you start to make changes, you really have to take in totality what that is going to do to the entire state economy, and particularly to the healthcare economy. And I would argue that a lot of what we have done, particularly with our home and different programs, has really stabilized that healthcare economy that it was in place to serve people in rural Arkansas during the pandemic. And those rural hospitals and critical access hospitals, even the mid-sized hospitals, are still reeling and trying to catch up from COVID, because they couldn't do elective surgeries. They had to just shut everything down. Your reimbursement level for a COVID visit didn't raise any.
That's really the key, though, is the Medicaid and
Yes.
Medicare reimbursement rates at the federal level have not changed
Correct.
in a long time. That's what's
correct.
causing the rural hospital and
Yes.
some urban hospital, suburban
Issues.
hospital problems right now. That's not something the state can fix.
No, we can change the Medicaid rates, but not very much. There has been a rate review that Governor Hutchinson put in place by executive order, but that has been systematic, and we have made some changes there. But generally, those are very tied in and locked in, and so we have to just always understand that landscape for healthcare, because you have such a mixture of Medicare, Medicaid, private insurance, self-insured. And so all of that is very complicated, and we have to take it all into consideration to stabilize our healthcare infrastructure.
I got about a minute left. The last question for you. AR Home is the Medicaid expansion program that has gotten its waivers from the federal government. You guys are set to move forward on that. Does Governor Sanders support its continuation? What have been the conversations you've had on that front?
Well, I think we haven't had many, because she's been really so focused on education and tax policy and criminal justice policy. policy, which is great. We have enacted what I think is really great policy and did it in conjunction with some consultants who are now also on board here in the administration, her new administration. So our home policy really is, I think, thoughtful, intentional, and it's the healthcare policy that was lacking all this time to really improve health outcomes. If we're not improving health outcomes, then we really need to change gears and shift it up and change it.
We've got a 3/4 vote in both chambers to keep it funded, correct?
Yeah, well,
We'll need one.
Yeah,
we will need one. You think it'll be there?
I really do believe in what we're doing with the Life 360 homes, helping our maternal homes and helping young moms and children and veterans and folks that have been in the foster care settings. I mean, looking at the data has helped us drive that policy as to who are these folks that we're actually serving through this program, and can we better meet their needs and improve our health outcomes as a state. And so that policy is very intentional and thoughtful and thorough.
I'll say it if you don't say it, because we got about 10 seconds left here. If they pull the plug on that Medicaid expansion money, it blows a hole in the state budget. So you don't have to say it, I'll say it.
It all works together.
Yes, Senator Irvin, thank you so much.
Yes, sir. Thank you so much.
Always great to have you back during the
Absolutely.
session. All right.
Yes, sir.
All right, we're back with more right after this.